please. Dr. Bruce, telephone. Dr. Davis, telephone, please. Dr. Davis, telephone, please.
Hello, and welcome to Dr. Williams Clinic, where health meets knowledge. I'm Dr. Ola. This week in Dr. Williams Clinic, we will discuss about asthma. What is asthma? Asthma is a chronic respiratory condition that affects over 260 million people globally. Asthma is a condition where the airways become inflamed and narrow, causing episodes of wheezing, shortness of breath, chest tightness, and coughing. It involves both inflammation and airway constriction due to hyper-responsiveness to various triggers. What are the causes and risk factors of asthma? In this video, I divide the causes and risk factor into 4 categories, which are underlying causes, genetic factors, environmental triggers, and lifestyle factors. Let's expatiate on the causes and the risk factor one by one. The first one being the underlying causes. Due to a combination of genetic and environmental factors, while the second cause or risk factor is genetic factor, people with a family history of asthma or allergies who are at higher risk. Third one is the environmental triggers, like pollution, smoke, allergies, respiratory infection can contribute to or trigger asthma. The last one is the lifestyle factors, like diet, physical activity, and weight can also impact asthma severity and control. What are the signs and symptoms of asthma? The common symptoms are shortness of breath, wheezing, coughing, especially at night or early in the morning, and chest tightness. Let's talk about types of asthma. In this video, I'm going to categorize asthma into 4 different types. The first one is allergic asthma. It's triggered by allergens like pollens, dust, mites, or pet dander. The second type of asthma is exercise-induced asthma, which involves symptoms during or after physical activity. The third type of asthma is occupational asthma, which is triggered by irritants in the workplace, such as chemicals, dust, or fumes. The last but not the least is severe asthma. This is difficult to control. It requires high-dose treatment and ongoing medical management. What are the common triggers of asthma? The common triggers that we have are dust, pollen, smoke, cold air, respiratory infections, strong odors, and stress. How do we diagnose asthma? Is physical examination and medical history. Doctors use patient history and physical examination to detect asthma. The second is spirometry and lung function tests. These tests measure how much air the patient can breathe in and out, helping to confirm asthma. The last one is allergy testing. Some people may undergo allergy testing to identify potential triggers. How do we treat and manage asthma? One is through medication. Second is lifestyle and self-care. Third is monitoring with an action plan. Let's expatiate on these treatment options or management options. First, I said it's medication, such as corticosteroid, which reduce inflammation and prevent attacks. The second option of managing asthma is lifestyle and self-care, such as regular exercise, healthy diet, and asthma management plan. While the third option of managing asthma is monitoring with an action plan, which includes recognizing warning signs and managing medications. Let's talk about life with asthma. People living with asthma may not have a regular life. For them to live a wonderful life without restriction or constraint, there are few things they need to do, which includes routine self-care, monitoring symptoms, staying consistent with prescribed medications, and when there is attack, they should stay calm, use a rescue inhaler, and know when to seek for medical help. I'm going to give us few prevention tips on this video, such as keeping a clean house, avoiding no triggers, managing stress, staying active with asthma-friendly exercise, use hair purifiers, and manage allergies. These are the tips to prevent asthma attack. What are the takeaways from this video? One is that it is important to understand that asthma is a manageable condition that requires awareness of symptoms, triggers, and treatments. The second takeaway from this video is I encourage you to learn more, work with hair care providers, and create a personalized asthma action plan. Lastly, please share this video for awareness and check out more educative and informative video on this channel. Stay healthy, stay informed, and I will see you in the next video.